Turning to the situation actually on the ground in Gaza, our colleagues at the Office for the Coordination of Humanitarian Affairs tell us that as widespread Israeli bombardments continues to be reported, ground incursions and heavy fighting are also affecting northern, central, and southern Gaza. OCHA says the flow of humanitarian aid into Gaza has dropped by 67% since the 7th of May. This is due to the closure of the Rafah crossing, the inability to safely and consistently pick up commodities that have been dropped off at on the Palestinian side of the Karim Abu Salam crossing, and limited deliveries through other entry points. Our humanitarian colleagues also tell us that health and humanitarian relief, as well as social services in Rafah, are being forced to close one after the other. This is due to expanding fighting in Gaza, insecurity, evacuation orders, and the need to channel resources to areas where displaced people are trying to seek shelter. The World Health Organization says that just one hospital in Rafah, that's the Al Emirati Maternity Hospital, remains partially functional. Despite intense hostilities, we and our partners continue to do all we can to support hospitals with critical supplies. On Monday, a World Health Organization and partners delivered supplies to Al-Hali Hospital in Gaza City. This included 15,000 liters of fuel and more than a dozen hospital beds, as well as medicines and trauma supplies for some 1,500 people. Dr. Tedros, the Director General of WHO, said the destruction of roads and lack of fuel and safe access for missions in Gaza continue to impede movements to northern Gaza. We can't predict what will happen. We're seeing an intensification of the military operation in Gaza. We want a humanitarian ceasefire because civilians need a humanitarian ceasefire to be able to feel safe, to be able to get the humanitarian aid they need, and for the hostages to be released, and for the families of the hostages to see their ordeal end. We've been talking every day about the deteriorating conditions under which we operate. It's not just the fact that the fighting is continuing, the fact that the Rafah border crossing remains closed. We saw that the floating pier is now inoperable. The telecommunications companies in Gaza are running out of fuel, which means that there will be no mobile phone service, no access to the internet, which will directly not only impact civilians, but directly impact our ability to operate. Every day that this conflict goes on, our operations become more and more challenging, more and more difficult, more and more dangerous for our colleagues.